Mr. Brett Guthrie.
Thanks, Duncan. Thank you very much. I've always liked to talk about this process as looks like they're trying to put a puzzle together, and they're trying to do anything they can to make the pieces fit. But in the end, it doesn't tell a picture. There's not a story at the end of the picture. And we'll worry about it later. And one of the pieces that they're trying to make fit, so this fits under their $1 trillion scoring, as we say, is misleading, is what they're doing to states. Today, on Saturday, as we're here today, my former colleagues in the state Senate in Kentucky are meeting and trying to put together a budget bill, trying to close $1 billion budget gap. And they're trying to do it by preserving the momentum we've had in education reform, trying to make college more affordable, but they are working tirelessly to try to make that happen. And what does this bill do? It puts $30 billion by CBO estimates onto our states. As we've seen, Governor Schwarzenegger has been here after initially talking supportive of health care reform about what it's going to do to his state, my friend Duncan Hunter's state in California. Bill Bredesen, a very well-respected Democratic governor of Tennessee. I'm on the border. I get a lot of the media. People know him. They respect him. He made his career in health care, says this is the mother of all unfunded mandates. Just to the north of me in Indiana, Governor Mitch Daniels says 500,000 more Indianans will be, or Hoosiers I guess I should say, will be on Medicaid and costing the state billions of dollars. It's going to cost my state, according to Heritage Foundation, $303 million beginning in 2014 to 2019. And we do a biennial budget in Kentucky, so as my colleagues are sitting there today hoping to piece together a budget, hoping that the economy will turn around, so when they meet again, they will be able to do the things like making college more affordable. They're going to have to address this $303 million mandate that's been put upon them. So as they're sitting there getting through this budget and say next year maybe they'll be at the light at the end of the tunnel, well, if we vote for this bill tomorrow, the light at the end of the tunnel will be a $303 million freight train going right next to them. It will affect college affordability in Kentucky. It will affect schools in Kentucky. So this just isn't about health care. It's about what it's going to do to all the other policies. And man, I'll just close with this. They're also profiting off of student loans. This is if you get the details of that bill, they're taking the profit off what kids are having to pay back on their student loans and transferring their money to pay for health care. Thank you. And I'd like to introduce my good friend from the great state of Mississippi, Greg Harper.